Welcome to Fortune School System, a co-educational citadel of learning with British and Nigerian curriculums, located at 16 Udosoro Street, Efiarafort, Uyo, Akwa Ibom State. Civil a safe and serene learning environment, well-equipped modern science and technology, clothing and textile, as well as ICT laboratories, well-stocked library, ventilated classrooms, fine art and French studios. We also run bus shuttle services, 24-hour power supply, and parade well-trained and experienced teachers. Our standard boarding facilities are comfortable, and our hygienically prepared cuisines leave our students feeling healthy and alert. Obtain admission forms at 3,000 Naira for nursery and primary schools and 5,000 Naira for high school at EcoBank PLC, FCMB PLC, and Zenith Bank PLC. Forms are free for all our returning students. Entrance examination are as follows: Saturday 8th May and Saturday 5th June 2021 at the school premises, 16 Udosoro Street, Efiarafort, Uyo, Akwa Ibom State, while Saturday 3rd July 2021 is scheduled for scholarship exams. For inquiries, call 0802 702 5262 or 0813 853 6800 or visit www.fortunegroupofschools.com. Fortune Schools, excellence through hard work.
It was glitz, glamour, mixed with palpable excitement as the United States Agency for International Development (USAID) staff of Heartland Alliance Nigeria Limited (GTE) and Nigerians from all walks of life welcomed the Honorable Minister for Health, Dr. Osage Enahire, to Uyo, the capital city of Akwa Ibom State, on Friday, 30th April 2021, at the grand commissioning of 7 X-ray machines in Uyo One-Stop Shop.
Help our youth the truth to know. Ye love and honesty to grow and live in just and true. With love, see heart to build a nation where peace and justice shall reign.
In his welcome address, the chief of party Heartland Alliance Limited GTE, Dr. Emmanuel Godwin, while welcoming the guests to the event, presented the organization and its accomplishments to the guests.
I want to introduce first of all the chief of party of the depopulation program here in Akwa Ibom State, Dr. Emmanuel Godwin, and I also be welcoming him to take the brief remarks of HIV represented program. Dr. Emmanuel, you are welcome.
Heartland Alliance Limited Nigeria, funding support from USAID, has been working and providing support to populations that are marginalized and vulnerable over the last 10 years. So we have been implementing the projects for marginalized communities for about a decade now. I think this year is our 12th year of consistent work and investment in identifying people who are HIV positive, linking them to treatment, and ensuring that they are violently suppressed, while providing a wide range of services: cervical cancer, viral hepatitis, mental health, human rights, and a wide range of services in an integrated manner. So we are gathered here today, again with funding support from USAID, to launch 7 X-ray machines spread across 3 states. We have 2 in Akwa Ibom. One is here, the other one is in Ekwe. We have 3 of those machines in Lagos State, and we have 2 in Cross River. Put together 7. So the X-ray machines have been provided with funding from the US government to support the program in Nigeria. So there are some key things I would like to point out. The X-ray machine here is for all people in Akwa Ibom. It's not for our program, it's also every HIV program and TB program. They can hook up to this platform and also benefit from what we are going to be providing here. It's not just about our program, it's about to improve case finding, TB case finding for the entire Akwa Ibom state. And that is why we have one in this senatorial district and another one in another senatorial district. We are hoping that for time and with funding, with support from USAID, we want to expand in the to ensure that at least we have a minimum of 4 in Akwa Ibom, and that will give us significant coverage to ensure that in all the different locations where we operate, we have the X-ray machine. We sincerely want to appreciate the support, of course, of the US government and the support of the Ministry of Health, because if we don't have that support, they will not be here today. I will not be where we are today. Also, the support from the Akwa Ibom State government. You can see the timber and calibers of reps from the Akwa Ibom State government that we have here today. So we have enjoyed tremendous support from the Akwa Ibom State government. Also from the National Agency for the Control of AIDS, massive support from at the national level and the state level. And all these are geared towards ensuring that we achieve epidemic control. And that is why we're all gathered here. Sincerely, on behalf of Heartland Alliance, the board of Heartland Alliance, ably led by Professor Morenike Upon, and the entire staff of Heartland Alliance, I want to welcome everybody and thank you for finding out time to join us in this landmark event. Thank you very much.
Thank you.
The participants had the ample opportunity to present their goodwill messages, even as others joined the events via Zoom.
NACA is about the multi-sectoral response, not just about health. That means that we take time to pay attention to other sectors. And we know that every sector complements the other. So we're very, very happy that this component of the KP Care project is coming on board. Also even more happy that we're going to have people from the general public, benefit from these X-ray machines and this program at large. So we congratulate Heartland Alliance and congratulate Akwa Ibom State government because this is happening here. And we congratulate every partner here seated because we know that it will benefit also.
One of the most important things I've heard today is the fact that this is going to be made, for the general public. People can actually access this, and we pray that they can, receive more so they can cover the entire districts of Akwa Ibom State. I want to tell you that the governor is really, really excited about all the good things that our development partners are doing in Akwa Ibom State. And we'll take time to inform the ambassador and tell the ambassador all of this when she comes in next week. So on behalf of the government of Akwa Ibom State, I thank you and I congratulate you once again.
I'd like to congratulate Heartland Alliance and the good people of Akwa Ibom State on this great milestone. Over the years, it's almost as if we've been chasing shadows, trying to achieve epidemic control in area of TB as well as HIV. And there has always been constant reminder that we need to integrate HIV with every other disease entity. Without that, we will not be able to get to the promised land, which is achievement of epidemic control.
The Police Action Committee on AIDS has enjoyed this partnership in caring for HIV/AIDS infected subjects and people, the key population. So it has dated back to lots of years, and we have really enjoyed it. So we want to commend the Heartland Alliance on behalf of in fact I will even date it back, or I will scale it up to the Inspector General of Police. We want to appreciate Heartland Alliance. Right from there in Abuja, we enjoy a robust partnership with them, and it has been so wonderful. So we want to appreciate you, Heartland Alliance, and for the particular function and project that you have thoughtfully implemented in Akwa Ibom State. It's worth the while. It's worth it. I can't overemphasize that. A very, very interesting thing for me. So because having heard about this installation of the X-ray machine, and it's like I should just leave and come and start doing something. So I want to appreciate you, and I want to say it is wonderful. Thank you very much, Heartland Alliance. Thank you, our other partners, UNA, USAID. God bless you. And you can be rest assured, sir, that we do all that we do in our best to provide security for lives and also property, like such installations.
We came into contact with Heartland Alliance, I think, late last year, and I was shocked at what we were losing the kind of things we would have done together, especially in providing care for most of our girls who were raped and all that. And so when we connected, we've been working together a lot. But I think most of the people I want to see are here, and I want to suggest that we should have these services, especially for testing of HIV and all that, in primary health centers across the state, because it's always very difficult for me to pick a child that has been raped maybe in Etina or Oborokara and have to bring her here, or to Eket where we have the sexual referral centers. So if there's anything we can work together with the primary health center, I think they have an agency in Akaibo, so that we can have these test kits and the PEP. We had a case recently where a girl was raped, 14 years old, and then she came reported at the police and left without being tested. But we tested the suspect and we found that it's HIV positive. And the problem we have now is that we cannot get the child, and 72 hours has passed. So we want to have places where that, closer to where these incidences happen, so that we can get, this things down to the grassroots and all that. Thank you so much.
Personally, I have been in touch with Heartland. I interact as far back as 2015. So when it comes to innovation, I think I'm not surprised at this, because Heartland has been the front runner when it comes to innovative service delivery, especially with regards to humanity, particularly to KAPs. Heartland, I just want to say, well done, more grace to you. Well, with regards to TB and HIV in the States, we are all aware what the HIV situation is in our private states and vis-a-vis TB. So this is going to complement every other service delivery from other IPs to help us find missing TB cases. Our private state rate one of the highest amongst the ITB locations in Nigeria. So this is really going to help us look for, identify these missing cases, properly, diagnose them and place them in treatment, so that we can collectively bring about the end to TB. So once again, on behalf of both parties, I say Heartland congratulations and quite good congratulations. Heartland Alliance working together, working together collaboratively to improve the lives of people living with HIV and AIDS. Appreciate other agencies that work together with us as we implement both facility-based and community-based intervention, seeing that we're all working collaboratively is the key thing to achieving epidemic control. So on behalf of all the partners, once again, thank you. And we're thrilled at this development and expected output. Thank you very much.
I'm so delighted to see what is going on now. When I came on board, one of the programs I made was the innovation that Heartland Alliance brought into HIV care. Bringing this comprehensive package to one single area where people could come in, get tested, take drugs, get counseling. And for me, this is a way of increasing the efficiency and effectiveness of service delivery. So I must commend you on my life. Keep thinking, even what you have done today, opening up your services for the people of our 5 states across the 3 senatorial districts. We are so delighted to have to do that. So I think we should be thinking of how to sustain this good thing. And I believe that the innovation you have brought into it will also be taking that part. Thank you very much.
The chief host of the event, who was the Honorable Commissioner for Health Akwa Ibom State, Professor Augustine V. Umor, who was ably represented by the Director of Public Health, Dr. Akro, in his remarks, said he is passionate about development and the team. The Honorable Commissioner said the state government is passionate about the sustainability of donor agencies' contribution to support the health projects in Akwa Ibom State, hence the provision of counterpart funding.
The state government has gone ahead to establish what will ensure that counterpart funding would always be available, such that at the exit of implementing partners, the programs or project can still run to the benefit of the people. An event like this, though we have played down on it, maybe because of the realities of time, the COVID-19, it would have been greater than this. Because what this portends is something that we should escalate globally. But we have played it down because of the realities of the time. Subsequently, we will ensure that we engage effectively with all partners that will drive the implementation of this integrated program to an extent that we will all be proud. Somebody mentioned that Akwa Ibom is high with regards to incidence of TB. That is a fact, but against that fact, this program is going to help us to see and identify all those cases that we had missed in the past and put them on treatment. Once again, I would like to welcome all of us to this event, to Akwa Ibom State. So thank you very much and God bless.
On the spot, the Honorable Minister for Health, Dr. Enahire Osagie, ably represented by the Director, National Coordinator of National Tuberculosis and Leprosy Control Program, Dr. Chukwuma Anyaike, in his remark, expressed joy on the development and called for a cooperative effort to fight tuberculosis and health challenges.
Nigeria carries a very huge burden of tuberculosis. In fact, Nigeria is #1 in Africa and #6 in the world. When you count about the 14 countries in the world that have triple burden of tuberculosis, HIV, and drug-resistant TB, Nigeria is counted. We have 440,000 estimated cases each year in Nigeria. Tuberculosis is curable. So the only way we can control tuberculosis is to cut the chain of transmission. Get those people that have been infected, place them on treatment, and when they are cured, we will be able to pass to the next person. So we are struggling with that epidemic control. Now, after all we did last year, we were able to notify 138,557 cases. You will see that we have a huge gap, almost above 300,000 cases missing every year. And the literature has shown us that one case of tuberculosis, if not treated, can infect 10 to 15 persons in a year. So that is why I am very happy today. The facility that we are going to launch will help us to pick cases. And so I expect that this will be used very well, and if possible, expand the number. Know that HIV helps tuberculosis increase. HIV works on the immunity comes down, and then the tuberculosis comes up as an opportunistic infection and it becomes worse. So they are like husband and wife. So we must put our hands on deck to make sure we control it.
Welcome to Fortune School System, a co-educational citadel of learning with British and Nigerian curriculums, located at 16 Udosoro Street, Efiara Fort, Uyo, Akwa Ibom State. Civil are safe and serene learning environment, well-equipped modern science and technology, clothing and textile, as well as ICT laboratories, well-stocked library, ventilated classrooms, fine art and French studios. We also run bus shuttle services, 24-hour power supply, and parade well-trained and experienced teachers. Our standard boarding facilities are comfortable, and our hygienically prepared cuisines leave our students feeling healthy and alert. Obtain admission forms at 3,000 Naira for nursery and primary schools and 5,000 Naira for high school at EcoBank PLC, FCMB PLC, and Zenith Bank PLC. Forms are free for all our returning students. Entrance examination are as follows: Saturday 8th May and Saturday 5th June 2021 at the school premises, 16 Udosoro Street, Efiara Fort, Uyo, Akwa Ibom State, while Saturday 3rd July 2021 is scheduled for scholarship exams. For inquiries, call 0802 702 5262 or 0813 853 6800 or visit www.fortunegroupofschools.com. Fortune Schools, excellence through hard work.
High point of the event was the commissioning of X-ray machines and inspection of the different units of the organization.
On behalf of my boss, Honorable Minister of Health, Federal Republic of Nigeria, I call this for the service of humanity, for the good people of Akwa Ibom State, for the good people of Nigeria. God helping us.
Direct digital. So once I expose, that is the chest stand. Once I make an exposure on this chest stand, the image is seen on this screen. Yeah.
Yes. Do you have that level of interaction? They send samples to you. Do you follow it up? Yes. Because there is need. Heartland is taking care of almost 50,000 people. So you should be able to know whether those people are really taken care of in terms of TB. Do you understand me? So the ones that tested positive, with your doctor, are they placed on preventive medication for TB?
Yes. The ones that are positive will do a referral immediately to the
one tested HIV positive.
The HIV positive, they will place on
IPT.
Yes, IPT.
Yes, they are placed on IPT.
We do that.
We have the data.
The Cradle TV Show on NTA crew had a one-on-one interview with the following personalities at the event.
The machines are basically top-notch machines. They are highly digitalized and mobile X-ray machines. And we work up with all the quality standards when it comes to the radiological regulations in Nigeria. We have our lead lining and every equipment that is supposed to ensure safety in that X-ray unit. So that's it basically. We work up with all quality standards, ensuring that people's lives are not endangered when they access medical care in our clinic.
With regards to TB programming in the state, a lot has been done over the years, but a lot still needs to be done. Heartland coming up with this X-ray machine, particularly opening it up to the public, will go a long way to complement gene experts machine services used for diagnosis. This will help us identify a lot of missing cases because the challenge with diagnosis of tuberculosis can now be reduced to the barest minimum. The gene experts, with its advantages, diagnosing DSTB, also diagnosing DRTB. Then, with this kind of services now, and having radiological services and clinical expertise, interpreting the X-ray services is going to help us collectively find these missing cases, not only those among people living with HIV, but generally the public. We are going to defeat TB in the very near future in Akwa Ibom State and Nigeria.
As an organization, the kind of treatment services we provide, that is actually necessary that we should have that here. So we didn't want a situation whereby we are providing services and we're not doing more comprehensive services. So we wanted to be sure that we are providing comprehensive services. So that's actually why you're seeing what you saw here today. Our message to the general public is that Heartland Alliance, we are here to stay. And with what has happened here today, it's good the way that my chief of party has spoken that the X-ray machines that have been commissioned today by the Honorable Minister ably represented is not just for only clients who are directly involved with Heartland Alliance. It's open for all the other clients. that are working with clients to all the IPs in the states. So they should feel free to come in here and access the X-ray services that we offer, and they are all free of charge. I think that should interest you more to know that all the services we offer in these premises are free of charge, including the X-ray services. Here we provide what we call antiretroviral therapy services for those who are positive to HIV. We also do what we call cervical cancer screening, and then we also test for sexually transmitted infections, and we also treat. We don't just test, we test and we treat. And then we also test for tuberculosis. And we do what we call pre-exposure prophylaxis. That's where the issue of PrEP comes in. Because we know that because of who our target audience are, even before you get yourself exposed to HIV, you can actually prevent yourself from doing that. And all these services are free of charge.
Welcome to Fortune School System, a co-educational citadel of learning with British and Nigerian curriculums, located at 16 Udosoro Street, Efiara Fort, Uyo, Akwa Ibom State. Several are safe and serene learning environment, well-equipped modern science and technology, clothing and textile, as well as ICT laboratories, well-stocked library, ventilated classrooms, fine art and French studios. We also run bus shuttle services, 24-hour power supply, and parade well-trained and experienced teachers. Our standard boarding facilities are comfortable, and our hygienically prepared cuisines leave our students feeling healthy and alert. Obtain admission forms at 3,000 Naira for nursery and primary schools and 5,000 Naira for high school at EcoBank PLC, FCMB PLC, and Zenith Bank PLC. Forms are free for all our returning students. Entrance examination are as follows: Saturday 8th May and Saturday 5th June 2021 at the school premises, 16 Udosoro Street, Efiara Fort, Uyo, Akwa Ibom State, while Saturday 3rd July 2021 is scheduled for scholarship exams. For inquiries, call 0802 702 5262 or 0813 853 6800 or visit www.fortunegroupofschools.com. Fortune Schools, excellence through hard work.